The normal life. In early 2020, while the world was shutting down, Annie's life looked normal. She was athletic, healthy, a former college soccer player, the kind of person doctors usually describe as low risk. And then one morning, she heard a sound, a soft click in her jaw. Not pain, not fear, just a click. She ignored it. Because when you're young, healthy, and busy, your brain files things like that under not important. That click would become the beginning of a medical nightmare. Act 1. It's just stress. The clicking turned into pain, sharp, persistent, relentless. Eating hurt, yawning hurt, talking hurt. Annie went to a dentist, then a specialist, then another specialist. The answer was always the same: TMJ, jaw tension, stress. She was told to relax, to stop clenching her teeth, to manage anxiety. One doctor even said, "A lot of young women are holding stress in their bodies right now." So they treated her jaw, procedures, devices, even surgery. None of it helped. The pain didn't go away, it got worse. Act 2. The body starts changing. Then something stranger happened. Her face began to change. Subtle at first. Swelling, tightness, a feeling that her own skin didn't quite fit anymore. Her joints ached, her hands hurt, her energy disappeared, her period stopped. She told doctors everything, and again the answer came back polished and dismissive. Hormones, post-pandemic stress, burnout. No one connected the dots. Not the jaw pain, not the facial changes, not the missing period. Annie started to feel like she was losing her mind. She would look in the mirror and think, "Something is wrong with me, and nobody is listening." Act 3. When you pay for answers. Eventually, Annie did something most people can't afford to do. She paid for answers, out of pocket, over $21,000. She traveled to a private clinic in Colorado that specialized in complex diagnostic cases. There, doctors didn't treat one symptom at a time. They looked at everything: blood work, hormone panels, MRIs. And then someone finally said the words that changed everything. "You have a tumor on your pituitary gland." A tumor in her brain. The pituitary gland controls hormones, growth, metabolism, reproduction. The tumor had been flooding her body with excess growth hormone. The diagnosis had a name: acromegaly. Rare, often missed, slowly destructive. Suddenly everything made sense. The jaw pain, the facial changes, the joint pain, the hormonal shutdown. Annie cried, not just because she was scared, but because she finally had proof that she wasn't imagining it. Act 4. Surgery is not the end. Doctors moved fast. Brain surgery was scheduled. They removed the tumor through her nasal cavity, a delicate, precise operation. At first, it looked like a success, until it wasn't. Days later, Annie developed a severe infection, bacterial meningitis. Her brain was inflamed. She spiked dangerous fevers. She was rushed back into surgery. She spent days in the ICU. Lights, monitors, IV lines. At one point, doctors told her family, "We're doing everything we can," which is medical language for, "We don't know what happens next." She survived, but recovery was brutal. Months of weakness, pain, fear, and the knowledge that acromegaly can come back. There's a 20 to 40% chance the tumor could return. Ending. The real message. Today, Annie is alive, healing, carefully monitored. But her story isn't just about a rare disease. It's about how easy it is for medicine to miss something when symptoms don't fit a clean box. It's about how often pain, especially in young women, gets labeled as stress. And it's about how dangerous it can be when no one listens long enough to see the whole picture. Because sometimes a clicking jaw isn't stress, it's a warning.